Hello, my name is Rachel Gramajo, and I will be presenting my presentation on clinical vampirism. Although clinical vampirism has been addressed in psychiatric and fictional literature for many years, the DSM-5 does not recognize it as a distinct condition, and peer-reviewed literature and research are limited. Clinical vampirism, which may also be known as Renfield syndrome, is defined as a mental illness with an obsession of drinking one's blood, known as autovampirism, and or engaging in drinking another's blood while experiencing sexual arousal. It may be argued that although vampirism is not highly recognized, there may be a comorbidity of other mental illnesses. Clients are frequently diagnosed with the DSM-5 mental diagnostics such as schizophrenia or one of the paraphilias on the psychiatric spectrum based on behavioral manifestations such as delusions of being a vampire, fetishes, and excessive blood drinking. Other comorbidities may include anxiety disorders, affective disorders, and addiction disorders. The initial cause of paraphilia is unclear, yet there has been discussions of a few contributors. One of the contributors is in the form of exposure to an excessive pervasive environment. Although the causes are not fully understood, it was thought that excessive stimulation outside of socially sanctioned heterosexual marriage put people at higher risk of sexual aberrations. Another factor that has been discussed by the psychoanalytic perspective theorist is clinical vampirism is often linked to early problems in child development or traumatic relationships, according to the studies. A case study that I was able to find was based on a 36-year-old Caucasian male who was diagnosed with schizophrenia. He went by the name Vladimir B. He first mentioned his first encounter at the age of 21 when he had his first schizophrenic break. He was invited by 5 other members who believed themselves to be vampires, tapping and drinking their own blood. Through time, eventually they all began drinking each other's blood. This occurrence went on for about 15 years. The most common usage of this practice was via needle use. I'd like to argue that it may be seen as a victimizing sexual deviation. The reason being is that not only is the individual placing themselves and others at a higher risk for contracting the bloodborne pathogen, but the individual may not be receiving the proper care for what they really need assistance with. For example, they're comorbiditing other mental illnesses such as schizophrenia, anxiety disorders, and so forth. Not only that, but unsafe injection practice does cause for more prone to be exposed to bloodborne pathogens, which then leads me to talk about ethical considerations. Like I mentioned before, they're at higher risk for contracting bloodborne pathogens. Their ill practice of needle injection usage, although I was able to find that that is not the only form of ingesting the blood, but it's the most common practice via needle use. And unsafe injections are common, and they now account for a considerable fraction of all new hepatitis B and C infections. Not to say those are the only bloodborne pathogens that they are able to expose themselves to. Those are the many few. Now, like I mentioned also before, I feel like these individuals are not getting the proper treatment, such as cognitive behavioral therapy and psychotherapy, that are known to essentially help them through their traumatic experiences that led them to start practicing these unsafe practices. Thank you so much. I appreciate it. I look forward to hearing everybody else's presentation, and that is all for today. Thank you.